Alright guys, so they actually gave a scenario, a clinical scenario, and they asked some questions on it. So they said that a 70-year-old man presents with anemia and massive splenomegaly, that's enlargement of the spleen. So when you do a blood film, it shows that there's what? Leucoerythroblastosis, right? That means I think it should be like increased white blood cells and also increased number of erythroblasts. Okay. So there's also a dry tap on bone marrow. Okay. So you should list 5 differentials starting with a possible diagnosis, right? Then list possible investigations for diagnosis of this condition, right? So we have all the diagnoses, I have the pictures of the diagnosis so that at least we can make sense out of this. Now, first of all, there's leukoerythroblastosis, massive splenomegaly, there's anemia, right? That means red blood cells are going down. That's the mature red blood cells are going down. But white blood cells are going up. Erythroblasts are going up. Right? So possible diagnosis could be what? Primary what? Myelofibrosis. Right? The polycythemia vera. Polycythemia vera could be due to maybe some uh, maybe bone marrow disease causing production of some excess blood, right? So essential thrombocytopenia, known as increased platelets, then myelodysplastic syndromes, then acute myeloid leukemia. All of these are the possible what? Diagnosis, right? Then primary myelofibrosis is like the main stuff. Okay, so this is essential thrombocythemia, where there's like increased production of platelets. This is what? Polycythemia, right? Then yeah, this is myelofibrosis. Okay, so all of them actually I've made videos on them. So maybe if you want to now know them individually, simply comment and I'll get it to you. So this is acute myeloid leukemia. Okay, where blood cells of myeloid origin are kind of like becoming cancerous. You get. Then moving forward, for you said that for the possible, they said that you should also list the possible investigation that you might do for this patient because you are not sure. You are giving differential diagnosis, so you want to now bring things that uh, investigations that will make you now be sure of the condition, right? So you might want to do things like what? Full blood count, all right? So most of the times you see anemia, which is progressive with disease. There's increased platelet count. So thrombocytopenia, um, okay, sorry. Increased platelet count should be what? Thrombocytemia. Yeah, it should be thrombocytopenia, right? Sorry, this was a typo, right? So neutrophilia is common. Neutrophils are going down. Then modest basophils or eosinophil count. So as degrees progressive, leukopenia can increase. Okay. Then peripheral blood count, you see myeloid and erythroprecursors in peripheral blood. That's the leukoerythroblast picture that we were talking about, right? That the patient presented with. All right. Then what again? This full blood count, yeah. This peripheral blood film. Then bone marrow aspiration. We already know all of that. Then bone marrow what? Tryphin biopsy, right? So that one is essential for the diagnosis because you are strongly suspecting what? Primary myelofibrosis, right? So primary myelofibrosis is further divided into the early one and overt one, right? So the early one is hypercellular, tumor cells in the bone marrow, right? There's disorganization of the bone marrow architecture. Note that the red blood cells were decreased, but erythroblasts were up and the white blood cells were up, right? And you see that you see megakaryocytes. Those are the ones the ones trying to develop into platelets, right? Then for the oval type of this primary myelofibrosis, there's bone marrow fibrosis, there's osteosclerosis may also be seen in few patients. Right. The mutation studies, you do studies on genes like JAK2 and the CAL mutation. Right. So that's it for this type of patient. Right. A clinical case.